This is Lisa. Lisa is celebrating her 40th birthday today, surrounded by family and friends. Today is all about cake and balloons, but tomorrow she'll be thinking about her health. At her last checkup, Lisa's OB/GYN, Dr. Suarez, recommended that when she turned 40, she should start getting regular mammography screenings to test for breast cancer. Breast cancer is the most commonly occurring non-skin cancer in American women, and the second leading cause of cancer deaths among American women of all ages. There are several methods for detecting breast cancer: self-examination, clinical breast exam, mammography, ultrasound, or MRIs. But mammography is the only screening tool proven to reduce the rate of death from breast cancer. Breast cancer deaths are decreased by approximately 30% among women who get screened with mammography. On her way to meet her best friend for coffee, Lisa is thinking about all the new information she learned from Dr. Suarez. In 2015, doctors are anticipating over 230,000 new cases of invasive breast cancer. She also learned that 21% of all breast cancers occur in women younger than 50. Lisa meets her friend Aisha at the cafe and discusses what she learned from her doctor. Some women are at higher risk of breast cancer, including those with a family history of the disease. But Aisha's doctor said that 75% of women diagnosed with breast cancer don't have any high risk factors. That means that everyone needs to be screened early and regularly. Lisa heads home to have dinner with her brother Derek, a medical student. Lisa's still on the fence about scheduling a mammogram, and she has three major concerns. She is worried that the radiation exposure could do more harm than good. She doesn't know how she would handle a false positive result, which would mean more tests. And she knows that overdiagnosis is a concern, meaning that they could find something that if left untreated would never have hurt her in the first place. Over dinner, Derek explained what he had learned in medical school, that these risks have largely been disproven. He tells his sister that there's no measurable radiation risk for a woman her age, and the risk continues to go down the older she gets. He also read a study that showed that 63% of women would accept 500 false positives if it meant one life was saved. Lastly, the overdiagnosis claim has largely been discredited. It has been shown that screenings actually reduce the rate of invasive cancers in women. Opponents of screenings argue that mammography screenings are inconvenient and can cause anxiety in women. But Derek convinced his sister that no test was more inconvenient than undetected breast cancer that led to death. Derek said that each year there are now more than 30% fewer deaths from breast cancer than would have occurred had screening not been introduced. After talking it over with Dr. Suarez, Aisha, and Derek, and after reading up on breast cancer information, Lisa scheduled a mammography screening. At the appointment, the technologist gave Lisa advice to share with her friends. All women should have regular mammography screenings at age 40, and for women at high risk, earlier or supplemental screening may be appropriate. Mammography screening isn't perfect. It doesn't find every woman's cancer, and sometimes it's already too late to prevent a death. Its role is to detect breast cancer early, before it has a chance to spread. Each year, regular screening with mammography saves 15,000 to 20,000 lives in the USA. All major health organizations agree that the most lives are saved by screenings beginning at the age of 40. Get screened early and get checked regularly. To learn more about mammography screenings and the information and statistics featured here, please visit the Society of Breast Imaging's website